Today is January 16, 2021. I'm going to give you an update on the Swedish model against COVID-19. And right now is one of the most difficult times for us in terms we deal with COVID-19. And in the United States and around the world, again, the Swedish model is one of the best models for us to evaluate how this virus behaving and how we can control the virus infection and how to prevent this virus infection. As we all know that the Swedish model is a relaxed model which have very limited lockdown. And so this model is good because in this Nordic country, when Swedish practice relaxed model, but other Nordic countries have some kind of lockdown. Here, just to look at these cases as of January 16, 2021, in these 4 Nordic countries, and that includes Sweden, Denmark, Norway, and Finland. And we will look at the total cases, total deaths, and then also going to look at normalized in terms of 1 million population total cases and 1 million population total death. As of today, January 16, 2021, in Sweden is about 500,000 total cases, and Denmark is about 187,000 cases, and Norway is about 58,000, and Finland is 39,000. And total deaths in Sweden is about 10,000, and Denmark is 1,700, and Norway is 500, Finland is about 600. And so it's important to transfer this data in terms of 1 million population, so we can compare country by country in fixed population. And in terms of million population total cases, and Sweden have 51,000, and that is close to 2 times of Denmark, 5 times Norway, and 7 times of Finland. And the total deaths among 1 million population, Sweden is close to 1,000, and that is 4 times Denmark, and 10 times Norway, about 9 times Finland. So it's a huge difference. And if you follow me on my channel, I have made several videos about this Swedish model. And we always try to find questions why, and Sweden have much more higher total deaths than other Nordic countries. And we know that this is a very good comparison because these 4 Nordic countries that should have a very similar national cultures, histories, population size, and densities, and also immigration pattern. And on the other hand, even the roads where the virus was first introduced to the countries and how cases and deaths are reported, they're pretty similar. And the question always raises why Sweden have such high, 10 times high total deaths than other Nordic countries. And again, we talk about the Swedish model. Swedish model actually practice this relaxed model. And the Swedish national structure, the assumption of which is that in the government of health system, they enable the structure to continue without major course of correction. And the health authorities always try to practice some kind of herd immunity approach. so allowing community transmission to occur relatively unchecked. So right now, they really pay some huge price for this. So in terms of coronavirus testing, contact tracing, and source identification and reporting, and in Sweden it's very limited, and actually we can see it's not appropriate. So that's why they have so much big trouble for the country. And we know during the courses there's always some back and forward about the policies, how they can control the crowd, and what kind of strategy use. Even the masking, even now today, and this Swedish health authority still don't give proper guidance on how to use face mask. And so, even so, occasionally some of the officials said they use, and in the generally the government don't support and the general public to use face mask, and they don't practice to avoid crowd, and also don't support practice good hand hygiene and respiratory hygiene. And that is a major reason. And now good thing is that as of now we entered the era of vaccination, and I wish the vaccination may change this picture. And I think in all Nordic country, the government really to encourage his citizens to be vaccinated. And this picture just shows us that the king of Sweden was given vaccination of COVID-19 vaccine, and that's really great sign, and that's encouragement for the people to use this vaccine. And I wish that the government is going to implement this strong COVID-19 vaccine program, so to have strengthened interagency coordination and decentralized collaboration, provide great transparency and accountability, and so make sure that the monitored vaccination system, so more people get vaccination. And that's why this is the main reason I'm going to make this video. So again, I should point out that the original idea by Swedes try to let this virus transmit among his citizens through such a way to create herd immunity is not working, and the sacrifice is huge. Now we have time to create herd immunity, and create herd immunity through vaccination. I think vaccination is going to reach this goal, not through this natural infection. And I think vaccination is going to work and to prevent people from infection, and in the same time and create herd immunity among the entire world. Of course, includes Sweden. And that's the talk for today. I wish you a healthy and happy, and I wish you everyone to try to keep yourself from virus infection, because we are on the way to win. But we need to try to prevent this from the infection right now, and so we can save more lives, and more people's life can be saved through this vaccination. And I wish to see you in my next video. Bye.